So, welcome to this CMF podcast. Today, I'm here with two guests. My name is Susan Marriott. If we haven't met, I'm head of public policy at CMF, and I've got Michael Trimble and Abbie Englund with me. Are you both happy just to introduce yourselves, maybe say a bit about what you do, and then also your kind of links with CMF? Michael, should we have you first?
Okay, so I'm a clinical academic working in Belfast. My academic work is in the Centre for Medical Education. Ethics is one of my remits. My clinical work is in acute internal medicine.
Cool.
No, my
And
links.
yeah, tell us about how you've come to be involved with CMF and what you get up to with us.
I've been involved in student CMF in Dundee many years ago. Been quite heavily involved there, and then on returning to Belfast and graduating, I'd sort of got between the busyness of work and exams and family. I'd probably been more involved in church than CMF, but then have appreciated it as a sort of a national resource rather than maybe a local group. And as I've got drawn back into it, particularly around the time when the Royal College of Physicians were looking at their position on assisted dying. So
Yeah,
I got drawn back into the fray then.
and we're grateful for you. Abbie, tell us a bit about you.
Yeah, hello. So I am a third year medical student at the University of Edinburgh. And I've really loved being part of CMF over the past 3 years. We have a bit of a student group up here, and yeah, we have talks sometimes and socials, and that's been really great. Um, and I'm also doing CMF Scholar this year. So it's just a group of us who've we have teaching about once a month, and also work on some projects and writing and that sort of thing. So it's been great to have a space to think about both my career and also my faith and how they merge.
That's brilliant. Thanks for sharing that, Abbie. So the particular reason we've come to do this podcast today is related to some of your kind of ethical thinking with CMF, Michael, and you've written a CMF file. Many of us might be familiar with reading those. The topic of the file that you've written is so it's called Ethics, a Matter of Principle, and it's looking at something called principlism. What is principlism, and why did you want to write a file about it?
So principalism is a common approach to bioethics in the UK and in America. I think probably in the English-speaking world in general. It's based on the four principles of autonomy, beneficence, non-maleficence, and justice, and it views those principles as encompassing all that really needs to be considered in ethical deliberations. I have to admit, I'm not such a fan of principalism on its own. And as an educator teaching medical ethics, um, it seems to have such a grip on people's thinking that I wanted to write something exploring it and challenging it a little.
Yeah, thanks, Michael. That's that sort of the kind of describing it as a grip is really interesting. So it's about 20 years ago now that I was at med school and first learning my ethics, and I definitely remember principlism being, I kind of thought if I want to pass the exam, I should learn those four principles and kind of be able to kind of recount those, and that'll be kind of what I need. And that did feel like that was a very kind of prominent voice in what I was taught. Has that been your experience, Abbie? Has principlism been part of how you've been taught at med school?
Yeah, definitely. So I mean, even before going to med school, when you are preparing for your interviews, of course, you come across this idea of principlism, and if you're asked a question about ethics in the interviews, then you know straight away you're supposed to bring these ideas up. And I think yes, on their own, they're not inherently wrong ideas. I think they are biblical concepts, but as you were saying, Michael, when they are separated from Christian thought, it can be it's not a very solid foundation. As they're oftentimes presented as this sort of magical formula that if you tick all these boxes, then you are an ethical person, which I think is quite misleading, really.
So before you read Michael's file, Abbie, you were already having some of those sorts of thoughts, were you? Is that as you'd been taught about them, you had some questions come up, or
I think a little bit. I think Michael's file definitely made it a lot clearer in my mind. I guess just because you don't really think to question principalism because it's just taught as almost as fact, as in this is the way ethics is done. You know what I
Yeah,
mean? So you don't really question that.
yeah,
Um, yeah.
yeah. So, but you'd always, yeah, a little bit of a question. But yeah, as you say, Michael sets out a lot of things that are really helpful in his file. One of the things he talks about is the history of principalism and where it came from. Had you ever been taught any of that before, or did you find that helpful, Abby, to think about?
Yeah, I found that really helpful because definitely we are at least in my university, yeah, we're not taught about where these principles come from. I think both on a practical level, so just the history of it, and who came up with these principles specifically, but also on a philosophical level, like why do we actually care about beneficence or autonomy or that sort of thing? Yeah, so there's not really a deep exploration of where they're coming from, which I think Michael's file was quite useful in addressing, helping me to think about that.
Yeah, were there things about that that you tell your students, Michael, or you hope that your students will learn?
Um, Gosh, in sadly, in the time that I'm allowed for teaching ethics, I don't have the luxury of being able to delve into the history of principalism. I do refer to principalism, but I try to develop some foundations before that. So whenever you're considering principles, whilst Beecham and Childress' approach has the four, there are other principles.
Mm,
But how do you weigh those principles? That needs to be considered. What priority do they have? What other principles do you need to consider? And even just weighing up the four principles that are usually considered. A lot of people and a lot of writers in medical ethics would come out with things like, there are the four principles and autonomy is the most important. But then COVID comes along and suddenly autonomy about vaccinations or face masks, or suddenly autonomy is slipping down the rankings, and the non-maleficence or justice and fairness seems to be more in the public psyche and in the professional psyche. And if you chose to exercise your autonomy by not wearing a mask on the ward, you would be swiftly corrected.
that's really interesting. So, yeah, our experience can show sort of maybe the way we say things is a bit more malleable than we than we
Yes.
realize. Yeah.
So you need to have some foundations to know how to apply whatever principles you're looking at.
Yeah, that's really helpful. And it's interesting what you say as well about um, you know, their why these four and why not others. One I wondered about as a kind of principle that isn't there, which I think others have suggested, is kind of something about truth telling, or kind of, needing your doctor to be someone who tells the truth. We talk about that in terms of around research sometimes, but essentially it doesn't have a firm place in the four principles.
I think the concept is that whilst there are other principles, the four that Beecham and Childress set out are meant to wrap all the others up into this neat package.
Mm,
But as you say, it's not always apparent how that happens.
yeah, yeah, no, that's really helpful. Um, Abby, you already sort of mentioned in your initial reflections that these are maybe they are quite good principles. They're kind of they chime with our Christian faith in a way. Beneficence, doing good. That Jesus calls us to love our neighbor, to do good to them. Non-maleficence. We don't want to harm people. Um, yeah. Are there ever times where when you've considered these four principles, you've thought they're not good in some way, or would you agree that they're good principles and we should follow them?
Yeah, so I think on a superficial level, they definitely can be used in a very Christian way, in the sense that they all stem from treating other people as you would wish to be treated, and respecting them and having compassion for them. But I also think that there is potential for them to be manipulated to give justification to acting in a way which I don't think a Christian worldview supports. I think that's because the definitions are quite vague.
Mm,
So they, you say beneficence, but people will disagree about what that actually means in practice. So I think a good example is something like gender dysphoria is the beneficent thing to do to give puberty blockers to, children experiencing that, or to help them come to terms with their body and to, provide support in that with those challenging emotions. I think principalism doesn't help you to solve that tension, I guess, and it's not actually the truth itself. It just helps us to maybe consider what is true and almost like gives us a good framework and helps to guide us, but
Yep.
it itself doesn't actually give us the truth that we might find in scripture or, elsewhere.
Absolutely. There's one of the authors I quote notes his concern with principalism that it doesn't actually have a theory of the good. It's you can say that we want to work for the patient's good, but I mean, who wouldn't want to do good? But when it comes to recognizing good, that's a lot harder. And even a couple of my favorite authors, Pellegrino and Tomasma, one of their books is exploring the whole idea of what you mean by good. Is it just the biomedical good? Is it the patient's view of what's good? Is it some greater view of the good? What do you mean by good? Um, it's as you say, the background or the whether you have a Christian perspective or a secular perspective, that'll look very different in a lot of circumstances.
Yeah, that's really helpful. And we could apply that to the other principles, I guess.
Oh,
So
absolutely.
yeah, that's really helpful. So I guess some of what's coming out is that there's something helpful about these four principles. We've said they help us to bring to mind different areas to talk about. There's something that can be helpful about them, but they're limited. But I think in the file, Michael, you're starting to draw out that you actually wonder whether they might sometimes not just be kind of useful but limited, but sometimes actually they limit us as ethical thinkers. Do you want to say a bit more about your
It's,
reflections on
it,
that?
I try and bring out the idea of thick versus thin debate, and thin debate's very much sort of superficial. It's more you've decided on something and you're trying to work out how to do that fairly, justly, or whatever, without the deeper thing of is it the right thing anyone should be doing at all. You might think of that in terms of some research. We often get into the ethical question of how a bit of research should be applied, like gene edit, germline gene editing. Should that, how does that work? How should it be regulated? Whereas someone may perhaps have been better at an earlier stage saying, is this something we should even be considering? Because if you edit germline DNA, it's going to be passed from generation to generation, and it's going to be edited in a sort of in a well, frequently at an embryonic stage or a pre-implantation embryo, and what are you going to you're not getting consent from the person whose genes are being edited, and certainly not from the next generation. But so should you be doing this at all?
Yeah, and principalism doesn't help us so much there, is that what we're saying?
Well, autonomy, it's the autonomy of the, if you're looking at say maybe the sort of mitochondrial disease three parent embryos, you're looking at the autonomy of the parents, of the clinicians, but not of the offspring.
Mm.
So you've no idea. You can't work out that it's going to be successful and not have its own problems, perhaps unanticipated problems. So autonomy doesn't really help. You're balancing, you're aiming for something good, perhaps, but how do you know about the harms? And then the whole question of justice, this becomes very high-tech, expensive Western intervention, and um, where do you stop? So I think principles can be nice pegs to hang thoughts on, but they don't direct you to a correct answer. This very much keeps the debate at a more superficial level, and I'd say that's I think has been almost part of the whole history of developing bioethics as a discipline. I think in the past ethics used to be part of the whole professional landscape of doctors. And then we've sort of retreated a bit, and you find that ethics is predominantly taught by people with you know, philosophy, psychology, or ethics degrees, and same with a lot of ethics committees or think tanks. And we have as a profession have almost sort of like outsourced ethics as opposed to keeping it something that the doctor as an ethical practitioner should be someone who understands and really gets to grips with the issues as opposed to just following following a guideline.
Yeah, it's really interesting. How's that been at uni for you, Abby? Are your colleagues kind of are they interested in ethics? They want to get to grips with these deeper questions, or does it? Yeah, how have you found that?
Yeah, yeah, I think, well, we had quite a bit of ethics teaching in first year. I think people are, in general, quite interested in it. I do feel sometimes that the debate is a bit superficial, as just as exactly as you were saying, Michael, because I mean, I remember a time in first year when I wrote an essay about the ethics of fetal pain and abortion. And for me, the question really begins with, well, what is a fetus? And does the fetus have that value of a human? And therefore, what obligations do we have towards the fetus? Um, but I ended up having quite a long conversation with an ethics professor who I guess was saying that's quite subjective, or focusing more on sort of the principalism approach of just checking these boxes. And I should rather have been discussing, the questions of autonomy and and justice and all these other things. Yeah, rather than almost bringing my opinion into the matter, um, which I don't feel is particularly true because I think it is immensely important whether or not the fetus has value, and that is integral to the argument. And so, I think if you just look at the debate on the level of principalism, you are missing a lot, and you are sort of hemming yourself in an ethical debate. But I guess, yeah, I think what people fear sometimes in um, like universities or educational institutions is because we've been told to separate our like religion and ethics, they fear going too deep into ethics because inevitably you will end up talking about, well, where do we get these values from? Why are humans equal? Which will then become a bit bigger and probably will lead into discussions around religion. So I think that's kind of interesting because it also almost implies that maybe part of the reason people are so keen to promote principalism is because it is, in their mind, a way of doing ethics without God. You know what I mean? Because you can say we get our morality from, these people who came up with these principles or, the GMC or whatever. I guess this is kind of a long-winded answer to your question. But yeah, I think there's definitely appetite for talking about ethics in medical school, but it often is quite superficial.
I think it's a very useful answer because one of the things on my to-do list for this week is to have a look at the GMC's consultation on doctors' values and how they relate to their practice and their patients. So and their colleagues as well. So I think yes, we can get rather constrained, not just by principalism, but by the culture that we move in.
Yeah, and Abby, you mentioned fear there as well. That struck me when you said that there can be almost a fear of going deeper because we might realize that there are things down there that we disagree on, and maybe we're not good at handling that, or we don't know how to cope with that.
I think that the fear is real. I had done a an eth I'd given an ethics lecture, and there were some of the some to an audience of 300. And there were some of I will often get immediate feedback from, sort of some of the folks in the front row. And so I was chatting to some of the guys after this lecture, and it turned out that they were CMF members. So that was good. And they appreciated some elements of the talk. And then a week or so later, there was a sort of follow-on tutorial, and we were discussing issues like end of life or sort of like abortion. And some of these guys were in the room. They were part of this smaller subset of students, and there were some vocal opinions on the pro-assisted dying, pro-abortion side. And I was sort of kept looking over, and there was silence. And at the end of the tutorial, as they were exiting the room, I sort of went, guys, what happened? And the response was just too risky.
Mm.
So
Yeah, it is. It's a fear, isn't it, that we can all experience. And I guess maybe principlism offers a lie in a sense then. So it's offering this idea that we can have a kind of risk-free ethics discussion with these things. We all agree on these things, and we can do just as good ethics if we just stick at this level without some of that risk. Is that fair, Michael? Do you think?
yes, and I think also it's very easy if someone's sharing an ethics discussion, if they keep it tightly to the four principles, you're not allowed to go off topic or mention something, sorry, that's veering into religion or philosophy. We'll stick to what's in front of us. I think that's a problem. I think one of my aims in lecturing is to try and encourage people to explore those deeper levels, both in their own thinking and to try and understand where someone else might be coming from. And it really does cut down to your core beliefs or your identity. Saying the file I referenced the sort of levels of moral discourse where you've got the top level. It's really the gut feeling and the almost the boo hiss response, and then below that it's recourse to rules, but rules have to be based on something and rules can be changed. So we've got the debate around assisted dying at the moment. Uh, that may result in a change in the rules. How do you evaluate rules? That's on the basis of principles. Sticking to the four principles, as you say, cuts out lots of others. But then how do you even choose what principles and how do you rank them? And that's where I would like students at least to have an awareness of that where they have got their values from, what forms their moral worldview, and to try and understand what forms someone else's. At that level, you know, it's not gonna be some sort of miraculous happy agreement that now we understand each other, we can get the right answer. But at least it means that the debate is serious and dealing with the actual issues as opposed to skirting around the edges or keeping it on the surface.
Yeah, that's really interesting.
Yeah. And do you, Michael, do you find that students are sort of willing to open up and talk about where they are getting their morals from, or is that something that they're a bit more
Um,
hesitant to do?
um, as I say, we have a very limited time. I get two lectures in year one and a follow-up tutorial. So whilst part of the tutorial aims to try and get them delving that bit deeper, I think it's a long way to go in a very short space of time. So and then I say that the next time I lecture them in big groups is in year four, and frequently I will allude to, you may recall this from year one, and get a lot of blank looks,
Mhm.
sadly.
Yeah. So, what then are some of the dangers of not going down to this deeper level? We said, in a sense, there's a risk to it. There's fear, there's a risk of going down to this deeper level. But what are the dangers if we don't do that for us as individuals or for our profession?
Um, well, you'd mentioned the idea that the principles will constrain debate, and there's a good example of that in a paper by Brian Brock and John Wyatt, discussing the issue of abortion and how even if a clinician may not feel comfortable at all with the request for a termination, the the system of approaching things with the four principles almost just leads to that sort of rather utilitarian outcome. Um, and they note that challenging this goes against the grain, and there will be the potential for resistance, for complaint, and that if society, if they talked about the Overton window, what the acceptable boundaries of something are in a society, if it shifts a bit more, we may find ourselves outside the window very much. And what, as I said, the GMC consultation, um, you know, at the moment, we've got conscientious objection as a protection. Um, what would happen if that got diluted or abandoned, and the duties of the doctor were reframed at some point to say that you must do this, you must carry out certain procedures, um, you must discuss assisted dying with every patient. Where would we stand?
Mm. Yeah, that's really interesting. Because I think I was thinking of the recent assisted suicide debates, and actually one of the kind of frequent phrases has been, about whether you have an in principle objection or not to assisted suicide. And actually, almost to get a hearing in the debate, you were sort of required. Lots of MPs start by saying, "I don't have an in principle objection," but then give some kind of practical
Yeah.
objections. And that in terms of the Overton window, that seemed to be the comfortable space of, as long as you don't have an in principle objection, you're allowed to have an objection. But actually to have a sort of de facto objection, say actually I think, killing is wrong. It was sort
But
of put you outside the window almost. Um,
even more to say, I serve the living God who made heaven and earth, and he tells me that this is wrong.
it's really interesting. Yeah, to think about it and see it kind of out there in public life as well. We are actually starting to hear some of these phrases. So we've said that it can feel risky, but there's dangers if we don't go deeper. Actually, for us, for the profession, we do need to go deeper. Um, so Abbie, if you were kind of in a seminar, I don't know if you get things like that at uni to discuss kind of ethics. Yeah, what might you want your kind of fellow students to have heard to encourage them to go a bit deeper? Are there things you would love them to hear, whether or not they come from a Christian faith, but they're just to encourage them in that?
Yeah, definitely. I guess just not viewing these four principles as an exhaustive list of, um, morality, and to maybe not be scared to think of other principles that aren't listed in these four, such as, sanctity of life, and having debates around, whether actually we have the right to take someone's life away, and that just because that maybe is not fitting perfectly under the four principles doesn't mean it's not still a valid ethical discussion. And I guess also realizing that even if some decision does tick off all four principles, that also doesn't mean it's automatically ethical. Because, I mean, as we saw earlier, there are different interpretations. So you can have two polar opposite decisions, which can both be seen to fit under the principles, like with puberty blockers or assisted dying. But obviously, they can't both be true. One of them has got to be correct because they contradict each other. So that is, I guess, the flip side of the coin. Also seeing that, yeah, the principles themselves don't even necessarily mean that it is the right decision. So I guess just having a broader framework, not throwing the principles out entirely, because as we've said, they can be used for good, and they are biblical concepts, but yeah, I guess just not being hemmed in by them, and not being afraid to step out a bit, maybe.
Yeah, that's really helpful. Michael, if you were chatting to maybe CMF members, students or early career, and they're thinking about their own kind of ethical reasoning, they want, how they think things through just for themselves, I guess. What would you encourage them in terms of yeah, should they use the four principles in their own thinking? What else should they do? How can they grow in their ethical thinking?
So I think that the four principles are very useful headings to organize thoughts under.
Mm,
Um, but they're not enough on their own. I mean, even the idea of autonomy, where does that come from? It comes from, as Abbie said, valuing every individual. Why do we value every individual, and how do we view people? The whole idea of what do you mean by good, and same with then non with non-maleficence or avoiding the bad and justice. You need to think what do these terms actually mean, and then again, as Abbie said, the other principles like sanctity of life. How do you weigh that up? And I think then just reflecting on that deeper level of who you are, and as Christians, we are the people of God. We owe our allegiance to Jesus Christ, and we need to try and grapple with what Scripture tells us about various issues, and that takes hard work because it's not just you're not going to be able to sort of look up the index of your Bible and find various topics. You have to do some hard thinking. There are other people who are there to help. The CMF files are a good resource. There are some books. It's a bit old now, but I would never hesitate to recommend John Wyatt's Matters of Life and Death.
mm.
He sets out a lot of the principles very well. Careful using the word
Yeah,
principle.
yeah.
He sets out a lot of the challenges and the foundations very clearly.
Mm,
Um, but there are other writers covering the same ground. So it's a good idea to read, to seek advice from other people who you trust to interpret scripture and ethics wisely. Also, does take a bit of courage to stand up whenever the rest of the room is going to disagree with you. But if we don't make our voice heard, then we're failing to be salt and light. And I freely acknowledge that, sort of uh, I've been a consultant for a good few years. If things got really, really difficult, there's always the option of taking early retirement. It'd be a financial hit, but you could do it. Whereas Abbie and her peers, if things get really hot and confrontational, for within the profession, that's a much bigger challenge. And then I think it's up to sort of my generation and groups like the CMF to work out how to support them.
yeah. What support do you think you guys need? I mean, yeah, how can you got a chance to talk to me as CMF? Like, what can we do better to help medical students with this? Do you think are there ways we can
Mm.
support you guys?
Yeah, I think just being able to have conversations with people who have uh at later stages in their medical career who know, I guess, the practical aspects of medicine and you have a bit more of an idea of what it actually looks like to, stand up for Jesus and Christian values. Because it can be quite theoretical sometimes, I think, as a medical student.
Mm,
People talk about standing up for Jesus, but then it's like, well, how does that actually look on a ward? So I think like conversations I've had that have been really helpful have been with people who've, shared examples of actually okay, someone like maybe comes to you as a GP and talking about abortion, what do you actually do? You know what I mean?
yeah,
And some
yeah.
practical examples that's been really helpful. Um, yeah, and being able to talk to other students who know what we're going through and the CMF resources as well, because I think, like these files are they're not like huge books. I know most medical students probably won't have time to read like huge books, but yeah, just having shorter resources that we can access is really useful, I think.
Yeah, well, great. Well, we've had a good chat about the file. I'm really hoping that lots of you listening will go on to read the file, and we'll put the link to it in the show notes so you can easily link to it there to kind of read Michael's argument there in full. And yeah, hopefully not just stop having read it, but go on to be someone who grows in confidence at kind of reflecting at that deeper level. But yeah, alongside seeing the usefulness of principles that has pegs to hang your thinking on.